I was about 5 when I was diagnosed with kidney disease. I think when I was about 10 or 11 was when they told me that I'd have to have a kidney transplant.
We had known that she had had some kidney issues for a while, and it was probably about a year before her actual transplant that we were seeing that transplant was in the very near future. She had held steady for a while in her levels in her blood, but it suddenly began to decline. And so we realized we were approaching that fact. Through research, we realized that University Hospital had a very good track record with transplants.
Usually, if you're a transplant candidate, the pediatric team would add you to the UNOS wait list.
I get asked a lot, how does the waiting list work, or who gets the next organ? Every different organ that a patient needs has a different type of algorithm that the waiting list follows. So for a kidney transplant patient or a patient who's waiting for a kidney transplant, maybe on dialysis, those patients are given first based on the blood type. Secondly, they are given certain points based on how long they've been on dialysis or their kidneys have failed them. Children get a higher priority on the kidney waiting list, and one of the reasons that decision was made in the United States was that it's very evident that children benefit greatly from getting a transplant as soon as possible. So if they can get a transplant at a very young age, they don't get some of the other problems that come with end-stage renal failure, like the stunting of their growth.
They told me that I would be on the waiting list and then I could get this call and they'd be like, hurry, we've got a kidney, you have to be there in the next 24 hours. It wasn't really like that. Since I had a living donor, it wasn't as urgent.
Kidney transplant, almost every patient is able to go on some form of dialysis. And in dialysis, everyone can maintain their life. So kidneys tend to be given to people based on how long they've been on dialysis or how long they've been at the worst degree of kidney failure. But liver transplant is different. There is sadly no dialysis for patients in liver failure. So the way that livers are shared are based on how sick a patient is growing. So sadly, the sicker you get is the closer you move to the top of the waiting list.
I just constantly felt sick. I couldn't eat. Anytime I would eat, I would just throw it back up. I was so nauseous all the time. And it was scary. Just the waiting period can be anything. I was listed 1A, so I knew that it wouldn't be that long, but it was still, every day went by, I didn't have a liver. I was like, when is it going to happen? When is it going to happen? Because it can happen at any moment.
You want to get a transplant while you're at your healthiest, but because of the shortage of organs, the way the allocation system is designed is they actually will give a donated organ to the person who is the sickest. So one way in liver transplant you can avoid that is that if you happen to go to a transplant center like University Transplant Center that offers live liver donation programs. And those are programs where a healthy person has chosen to give a part of their liver, and that is done in an elective date. The surgery is set and part of the liver is surgically recovered and then transplanted into the child or the adult. Once we put them on the national waiting list, we have teams of people who constantly stay in touch with them to make sure we're trying to keep them and working to keep them as healthy as we can until that organ becomes available.
After 6 days of being listed, Dr. Sigaroa came in and said, oh, we have a liver for you. Everyone in the room with me, they all just got so excited. They were like, oh, you're getting your liver. And I didn't really know how to react. I was just kind of in shock. I was like, oh, wow, this is happening.
My coordinators are amazing. I love them, and they just make everything so much easier, and they always make sure I understand everything. They tell me everything I need to know.
My advice to the parents out there is to realize that this is a process. that things aren't always going to go exactly as you hope that they'll go through, but you've got a lot of people that are very familiar with the situation. They've done this so many times before. They'll walk with you throughout the whole process, and to trust them, to wait and be patient, to ask questions, but at the end of the day, know that they're professional, know that they know what they're doing, and know that this is going to pass and it will get better.